Good day. Dr. Mark Dailey here. Today we're going to talk about roadblock number 2. In order for this to make sense to you, you have to allow me to explain in general what's going on in your body. If you're like 95% of my patients, you have an underlying structural condition that predisposes you to back pain. This could be an unlevel pelvis, which you probably already saw in your x-rays or will be seeing. It could be vertebral misalignments or degenerative joint disease, which is actually the progression of both of those things I just mentioned. This can cause inflammation. Inflammation is the accumulation of fluid around the joints and nerves. Among other things, this can cause stiffness, nerve irritation, and pain. So the condition you have has caused inflammation, and this inflammation increases pain and stiffness. Now, what I'm about to say is real important. If you are like 99% of Americans and eat the standard American diet, you already have a high systemic level of inflammation. That means you have inflammation all over your body. It's body-wide. This inflammation increases your chances of developing a ton of chronic conditions. So I consider inflammation as a very serious enemy. Your spine and your spine pain can be addressed by reducing systemic inflammation. Now, there is localized inflammation in your case, which means in your low back, for instance, or in your neck. But put that on top of this systemic inflammation, and it just doubles and quadruples the problem. The side effect of reducing systemic or body-wide inflammation might include reduced pain. Sound good? Increased mobility, weight loss, clear skin, more energy, greater mental focus. So how is it that we reduce this inflammation, you might be asking? Well, of course, the number one way is to change what we eat and drink. Let me conclude this video with a basic outline of this anti-inflammatory diet. I'll also give you a link that will explain in more detail if you want to know a little bit more about it, or if you want to apply it, which I hope you do. But basically, the anti-inflammatory diet revolves around lean meat, vegetables, fruit, nuts, and seeds. So as you can probably tell, we're leaving out all processed foods, all dairy products, all breads and starches. Again, if you want more information, click on the link on this page and I'll get into a little bit more detail. For the short term, to speed the process of healing, try following the outline that I mentioned above. Lean meat, fruits, vegetables, nuts, and seeds. We have one more roadblock to healing that I'll cover on the next video. Thanks so much. Have a great day.